Okay, sir. How can I help you today?
Well, actually, doctor, I need to ask you about the, like CT scan report, like what hospital has found in the report.
Okay, doctor. Okay, Mr. Mark, I have been through your file and I have noted that you have been is the inflammation of the outpockets of the large intestine, and you are suffering from it, and this will
Well,
settle with
actually, I
the
never
use
heard this
of.
term before, doctor. What do you mean by this? This is a serious condition. I'm quite concerned about that.
Yeah, I appreciate your concern about this. This is a disease in which there is inflammation. This gets settled with the use of antibiotics, and we have confirmed the diagnosis by performing CT scan. The CT scan report shows that there is inflammation of your large intestine outpockets.
Okay, but doctor, I'm quite
It's,
concerned that it could be something very serious.
can you please tell me what exactly concerns you about?
Yeah, basically, I have a positive family history of bowel cancer, as my mother died of bowel cancer.
Have felt the same if the same thing would have happened to me. The family history of bowel cancer is very important, and it's a separate thing from this disease. Bowel cancer can be detected early by doing regular colonoscopies, and we can tell you about the symptoms. If these symptoms usually occur, if there is altered bowel habits, if there is bleeding from per rectum, then you can go for colonoscopy and early detection. By this way, we cannot prevent, but we can early detect the disease. It's advisable if you have symptoms like altered bowel habits, you can and bleeding from rectum, you can go for colonoscopy for early detection.
Okay, doctor, I will do whatever you suggest me because I really don't want to have the cancer. Whatever guideline you will suggest me, I'll definitely follow that.
Now you should now I tell you that your condition is diverticulitis of the large intestine, and it will be better with the use of antibiotics, and you don't have cancer at the moment.
Oh, that's great.
And you should that's a good news, Mr. Mark. You should be if you have any problems like altered bowel habits or bleeding per rectum, you can go for early detection by doing colonoscopies. And this is I advise you to do colonoscopies if you have a positive family history,
Okay.
and you can go for regular checkups. And when there are signs and symptoms that show that there is some kind of problem with your colon.
Okay.
And meanwhile you should avoid constipation and maintain a healthy diet that includes more fiber in it. And you should use things that make the stool soft, and that will avoid your constipation.
Okay.
Mr. Mark, are you getting me?
I'm following you, doctor.
Yes. Mr. Mark, can I summarize?
Appreciate your counseling. First of all, the way you have started the card, it was appropriate, but it would be more better actually. You can start this card as you are experiencing if you are handling the patient for second time. So you can start in this way. Hello, Mr. Mark. I believe that today you're here to discuss your CT scan report that has been given to you. That has been, that you have been given to you by the hospital at the time of discharge, right? So,
Okay, sir.
uh, I can explain to you about the problem. So basically, CT scan confirmed that this condition is called diverticulitis.
Show your file, and I came to know that you are suffering from that your child is suffering from gastroenteritis.
hmm So yeah, and I need to ask you about the condition. What this condition is?
Yes, I'm going to tell you that the condition that the gastroenteritis is a condition. It causes vomiting and diarrhea.
Okay.
But you can explain me in your own words regarding your child condition.
Yeah, basically, I'm concerned about his hydration status, as in the last 24 hours he has been throwing up whatever he's eating. So, and
Mm-hmm.
also had like few episodes of loose motion.
Mm-hmm.
And yeah, like he's crying while urinating. So that is really concern for me. And there is some rash around the nape area as well.
Okay. Well, Mr. James, your baby is actually not dehydrated because he's playing happily on the floor, and the child is irritable. Is your child is irritable?
Yeah,
Okay.
but I'm concerned
But
that that he's dehydrated, doctor.
okay. I can understand your concern, but uh, but your child is passing urine regularly.
Yeah.
So he's not dehydrated.
Okay. So, doctor, what would you suggest for the, like treatment option for the gastroenteritis you told me?
O- Okay. You, you can give your child oral rehydration solutions after every stool or after every loose motion, and you can also give him a saline glucose solution. Other than and no other medication is required.
Well, I'm quite concerned that you're not to give any medication for him, as he has been throwing up and has low motion at the same time. So, like apart from the saline, there is no other appropriate solution for that.
No, the only oral rehydration or gastrolyte solution or saline glucose solution is enough, and continue breastfeeding more frequently. And initially the child may refuse any food or any oral rehydration solution or any other liquid or food, but eventually he may accept it.
Okay. So, yeah, I was about to ask you this question that,
Yeah.
like if you can see there that he has been on the breastfeeding now. So, what should I give the child now and after this episode will subside?
Sorry, मुझे समझ नहीं आई. Sorry.
Can you tell me, what should we give the child now and before this episode will subside?
Okay. You when the diarrhea is subsided, you can continue the regular food.
Okay,
Sorry.
okay, fine. It was fine. Uh, it was fine. You did it well. So I would
Mm-hmm.
like to tell you that before diagnosing the patient, you have to start the
Yes.
card with the symptoms, like after introduction of yours. Hello, my name is Dr. Blanc
Okay.
Blah. I'm another doctor in this general
Mm-hmm.
practice. I have gone through your file
Mm-hmm.
and I came to know that you are concerned about your son. So please, can you tell me in your own words what is your concern? Then
Okay.
the patient will, or the carer will tell you that he's concerned about the child hydration status. So you can assure the
तो
patient
सर इसके अंदर जो सफरिंग फ्रॉम गैस्ट्रोएंटराइटिस लिखा हुआ है तो उसको हमने स्टार्ट में नहीं
that
बोलना.
is the second part, no? That is the second part of your task. So
Okay.
yeah, you can see the task. That is the second part of the task. You will say that I've just gone through your file and came to know that you are having some concern regarding your child. You seems to be a bit concerned. If you can see the patient appears anxious, so that's why. So can you tell me in your own words what is your concern? Then the patient will tell you that I'm concerned about his hydration status. You can further ask the question,
Right.
what make you concerned? So he'll tell you that he has been throwing up and whatever. So you have to ask specific question, how many episodes of throwing up he has had, and how about the loose motion in the 24 hours, how many time he passed the loose motion, right? And beside
Okay.
that, you mentioned that he has been crying while passing urine. So what is the frequency of urine? Okay, fine. So Mark, as I explained, I gathered the information from you as he has been passing
Mm.
urine regularly. And secondly, you can see that he's playing happily on the floor. The last line of the history you can
Okay.
see. So these are the reassuring factor for you that there is no that he's not dehydrated, right? However,
Sir,
uh,
ये
Hello, good evening.
good evening.
I am Dr. Akash, one of the ENT doctor working in this hospital. How can I address you?
You can call him Mark.
Okay, Mr. Mark. What brings you here, please?
Doctor, I am having difficulty listening from the left ear.
Mhm. Okay. So I want to examine you. Can I go for that?
Right.
Okay. So I can see your tympanic membrane, eardrum with otoscope, and there is redness and pus is coming out of that. Mr. Mark,
Yeah, doctor.
uh, uh, I'm sorry to tell you that actually you are suffering from infection of the middle ear, infection of the ear. Okay.
Mm-hmm.
Actually, our ear is composed up of three parts: outer, middle, and inner ear. Uh, your middle ear got infected, and due to accumulation of pus behind the intact eardrum, that pus was under pressure and it burst out and came into your external ear.
Mm-hmm.
Okay.
Okay,
Are you following me?
doctor.
Am I clear up till now?
Yeah.
Okay. You must be having upper respiratory tract infection recently. Am I right?
I had pain previously, doctor, in my left ear.
Okay.
Yeah, but I
Okay.
am not sure about the upper respiratory tract infection. I don't remember that I had recently.
Okay. Okay. It happens. There is a tube which connects your ear to your throat in case of throat infection.
Mm-hmm.
That tube gets clogged and pus accumulates in the middle of the ear.
Mm-hmm.
And that pus was under pressure and previously it was painful. Am I right?
Yeah, it was quite painful to the point that even that the painkiller was not effective.
Yeah, yeah. So now it is less painful because it perforates your eardrum and it comes out.
My God,
Okay?
doctor, don't you think that a perforation is a serious matter?
No, this is an unusual occurrence, and this is not a unusual occurrence. It happens with persons who are suffering from this condition, which is termed as acute otitis media. Okay?
Mm-hmm.
So what will happen when this condition settles? This perforation will heal automatically within few weeks. Okay,
Okay.
and it will not cause any hearing problem. Do you have a such concern?
Yes, I was thinking that it would affect it. It has affected my hearing, doctor. Actually.
Yeah, currently it might be, but with the passage of time, when it heals out with complete resolution, it won't affect your hearing. Okay.
Mm-hmm. Okay.
So what are your other concerns?
Yeah, doctor, can you tell me that how it can be treated? Is there any treatment for that?
Yeah, I am going to give you broad spectrum antibiotics, a course for a couple of days, and then I will reassess you after this antibiotics course, and if necessary, I am going to advise you some audiological testing to assess your hearing. Okay,
Mm-hmm. Okay.
until complete resolution of the condition.
Okay.
Am I clear up till now?
Yeah.
Okay, so I want to advise you to some precautions for that. Okay,
Yeah.
so uh, first of all, you you avoid aircraft flight or craft and deep sea diving or any
No,
water
doctor, don't tell
entry
me. I
into.
already have purchased a packet for scuba diving. I was heading for that.
Okay, but you need to withhold these activities until it completely resolves.
Okay.
Otherwise, it may go into it may lead to the permanent perforation. Okay.
Okay.
Can I summarize this all about for this for you?
Yeah, yeah.
Mr. Mark, actually, you are having a middle ear infection, and the sequelae of that infection is perforation in your eardrum. So it will resolve automatically, but I am going to give you a broad spectrum antibiotic for a couple of days, and you need to avoid a few activities like diving and flight. Okay.
Okay, doctor. Thank you very much, sir, for your time. Sir,
Thank
I
you.
appreciate your counseling. You tried well. But sir, the patient was reluctant, so it would be more better that you can go for the open and closed end question initially. Okay, like
Okay.
as you mentioned that you are having difficulty hearing. So how long you have been having this problem? Okay, it was sudden in onset,
Okay.
or like did you have any other problem before that? So then the patient will tell you about the pain related problem. Then you can ask about the pain. Try not to use the medical terms or jargons. Tympanic membrane, you use it. Try not to use it. You did not
Right, sir.
report the patient knowledge. What do you know about the otitis media? Yeah, have you ever heard this term before? You have to ask this question. And I appreciate that you use the statement have I made myself clear? Or am I clear to you rather than are you getting me or are you following me? So we have to use this statement. You also have used some transition between the diagnosis and the we can say a bit the treatment plan. Never start the statement with no. Okay, try to. I appreciate
Okay.
your question. However, let me show you like that. Yeah, let me educate you. So there was one mistake that you self-corrected about the unusual happening. Secondly, you assure the patient, you let the card always encourage the patient to contribute, and audiological testing can be replaced with the hearing testing of your hearing, right? So
Right, sir.
between the precautions and the you can say treatment, though you have shown a transition, but there should be a proper signposting between these two things by asking about the clarity that it's still clear to you, or if you want to document any concern of yours regarding the treatment options.
Right,
You don't
sir.
have any question concern regarding the treatment option. I like to move on to the treatment. In terms of treatment plan, like that. And lastly, is the tone. You are monotonous throughout the session. Okay,
Mhm.
and try to work on your expression. Uh, w- and one more thing regarding the explanation of the otitis media, you can use it a graphical display, or let's say let me draw this thing for you, or either you can tell the patient. Can you see on the screen? I've displayed the the picture of the ear. We have three parts in the ear. I'm pointing the laser on the right part, left part, like that, but quickly, so that we can complete the card in time as well. Okay. So,
Yes,
is
sir.
it clear to you?
Morning, Mr. J. I'm Dr.
Good
Lubna,
morning.
and I welcome you in my suburban clinic. And I came through your file, and I came to know that recently we did some testing for your diabetes, and they came in the disease range. And I found out that you have questions about your testing. Can I
Diabetes
ask
also
you?
is the same as sugar diabetes.
Yes,
But doctor, I don't eat sugar. How can you say that?
actually, there are when the sugar level it's raised in our blood, then while testing the blood of the patient, and also if we take history from the patient, but symptoms or what he's feeling or what he's suffering through, we can clinically diagnose this diabetes. And what makes you so worried about this, please?
But doctor, like this is something that is obviously diabetes is a serious condition. So, but I need to ask you, you just did 2 tests. Like I want you to have some more tests. I don't believe in your diagnosis.
Actually, Mr. J, we just follow the international organization WHO's guidance or standards to measure the patient, and then we estimate the patient has blood sugar levels above or below it. Then we label them that they are having diabetes, and your test results came twice. 2 times we did during the last month your tests, and they both time they were above the normal limits. So only 2 testings, they are enough to diagnose a patient who has diabetes or sugar in the layman terms, whatever you say.
But doctor, I don't understand that. Like I want you to have some more tests, please.
Uh, you want to do more tests, but those tests, they will also be most probably they will be coming in the same range. If you I would just suggest you that if you have any history in your family, then it makes you more then you have more chances to have this sugar or diabetes. And early treatments, it is necessary. You have to take this treatment for all your life, and early treatment will makes you um, live a better life, and also um, your later on complications, as diabetes is a mother of all diseases, so it will save you also long-term complications. So uh, I think if you agree, we can start treatment for you. We can monitor your blood pressures. We can also do testing for your cholesterol, and that is lipids or fats in your blood. And they will also help us to monitor your disease, and also save you from the future complications. They will tell us if your blood vessels they are blocked or they are starting to block, because in the diabetes usually the micro or the smallest vessels, they start to block down, and if they block in head, heart, brain and feet, they can cause you problem. They can cause you problem for your liver, for your eyes. That's why it's called mother of all diseases. Do you have any other question?
No, I don't have another question, but I'm still concerned about the diagnosis. Like I don't understand that.
Okay, if you agree, we can do your further testing. We can do the oral glucose testing. If it is also advised, if you have to sit for 3 hours, we will give you some sugar and some drink, and then we will take your test before that sugar and after 2 hours, and they will confirm your diagnosis. Also, we would like to know about your body fats like cholesterols, because they have that they are not good with the patients who are diabetics. So we can assess you for other metabolic diseases also.
Okay.
And for the diet, if still you want more testing, but you have to review your diet and your dietary habits, your lifestyle. Dietary habits have to increase fruits and vegetables in your diet more, and you have to have an active lifestyle. It means if are you working in your are you um,
Thank you very much,
do
ma'am.
you sit all
The
day
time
in
is up.
your office, or
Thank you very
you
much.
are
Time
on
is
your
up.
free? Thank you.
Okay, ma'am. I appreciate that. You did it well. Keep it up. But like it has to be started with a tagging question. So what is a tagging question?
Okay.
Like after introduction of yours, you can tell the patient, I believe today you are here to collect your blood test report, right? This is a tagging question.
Okay.
Then it's not
Okay.
something that you can break directly about diabetes. Take the steps Okay, Mar, I can see from your file that you are having high blood glucose level previously, and unfortunately, this test report confirmed that it's still the same. It's high value of 7.6 millimole. So, what do you think? What could be the possible reason of having high blood glucose level in your body? Right? Expectation of the patient.
Okay.
Then you can tell the patient will tell you, I don't know. Then you can tell the patient, okay, unfortunately, as per the like these two tests, we believe that it's related to the condition called as diabetes mellitus. So, have you ever heard this term before? Then patient will tell you about the sugar diabetes. Again, ask the patient politely that what do you know about the sugar diabetes. Then do not negate directly, but you can tell the patient, I appreciate your knowledge. However, this is a kind of layman word, people use for the sugar diabetes. So I will educate you in detail. It's not only the case that you can eat sugar and you will be having high blood glucose level. It's a kind of mechanism. So I will explain you. Then explain the diabetes in layman language. Consider the fact that patient is going to give you tough time for diagnosis. So accordingly, design your explanation. For example, you can tell the patient, well, basically, then the organ in the body's function to regulate and control the blood sugar. Whatever we do eat, it translate into a compound, or in simple word, a sugar compound that will be required by the different organs, such as our heart, kidney, need them. So what happens in this condition? It can send either excessive or under amount of blood sugar level to the vital organ of the body that is potentially damaging for the organs. So this condition is called as diabetes. So I've explained the diabetes, and I also have take a lead from me because the patient is going to give you the tough time. As you can see in your card, it's written that patient challenges your diagnosis. So beforehand, I prepared myself. Before he can challenge
Okay.
you, that do more tests, you prepared yourself with the explanation of diabetes, because you can see at that time gravity of the situation that might not be that much heavy. So you have educated the patient about the diabetes, like what the diabetes is, in a concern that it will give you a help when the patient will give you tough time. Anyhow, when the patient asks you that you do it more tests, then you should use some standard vocabulary for that. Basically, Mr. Mark, as per the World Health Organization, after extensive research, this has become a gold standard in our medicine. So what you can do, I have the chart, I can plot your value on the chart. So you can see this red line is a threshold. I'm plotting your values. There is a significant difference from the threshold to your values. So I'm afraid that from how many months, year, I don't know, that your organ have been receiving this excessive amount of blood sugar levels. So it means that they are, like potentially, there's a possibility that it could be a potentially damaging situation for them. So don't you think that it is the right time to go for the complete monitoring of your diabetes or sugar profile, in addition to blood pressure and cholesterol? So what do you suggest?
Okay.
Then you can move on to the treatment option.
Okay.
Okay. So in between the card, you can see that you were speaking and speaking. You're not involving the patient. Try to encourage the patient to participate. Try to involve the patient time and again. It should not be one-sided consultation at any point in card. You did not use the sign posters. Even no cohesive devices were used. And there is a problem with the pronunciation of vegetables. You use vegetables. Okay. Anyhow,
Okay.
this was the feedback. If you like to ask.
Hello, I'm Dr. Ghazali Iftikhar, one of the doctor in the community health center. Can you check your name and age, please?
Well, my name is Gonsalves, and I'm 25.
Sorry, your name?
My name is Gonsalves, and I'm 25.
Sir, आवाज नहीं आ रही है अपना.
My name is
John?
Michael.
Michael, okay. How would you like to be called?
You can call me by name Michael.
Okay, Michael. Nice to meet you.
Thank you,
I
doctor.
have gone through your notes and I can see that you are having some ulcer in your mouth. Am I
Yeah,
right?
doctor, you're right. Actually, and I'm really concerned that I recently have started a job, and it's quite pressure-based job, and this is the first time I have to present
Mm-hmm.
a meeting tomorrow. So I need your help actually, so that you can help me somehow so that I can speak properly and I can eat something, because like it will be meeting, so I have to have speak at length and have a chit chat about the like about the lunch.
I can see, Michael, that you are quite concerned, and it's really a painful condition. Don't worry, we are here to help you. And can I ask you a few questions to know more about you?
Yeah.
Mike, do you have any history of any type of fever,
No.
ulcers in any other part of body, any eruptions?
Mm-hmm.
Do you have any history of increased sugar levels,
Mm-hmm.
dry mouth, or you have any increased urination?
No.
Do you have any change in your bowel habits?
No.
So what you have used for this so far?
Well, basically, I had this condition previously as well. So I had
Mm-hmm.
used the antiseptic gel. It's never helped me. In this episode, I did not use anything. I'm just talking about the previous episodes.
Okay, Michael. Michael, actually, I suspect that these are the after ulcers. Do you have ever heard about that?
No, I never heard this term.
These are actually the painful ulcers, and which can happen due to some infection, or sometime even it could be related to your job stress, and sometime it could be because of allergy or any viral infection. Do you want me to talk about how can we help you for that?
Yeah, I would. Yeah.
So what we are going to do, Michael, that we will offer you a blood test to check for infection. And actually, these are the after ulcers, and they take some time and they go away. And I understand that you have meeting tomorrow, and you want us to help you earlier. So what can you do that you can rinse your mouth with warm salty water, and also I will prescribe for you a medicated mouthwash, and you can apply antiseptic gel. Do you have any questions so far?
Doctor, as I mentioned earlier, that antiseptic gel never helped me.
You can use paracetamol. It will help you in pain relief. Also, you can
Mm-hmm.
use a plenty of fluids, and try to avoid spicy and sour foods.
Mm-hmm. Okay.
And if still you have pain, then we can prescribe for you any anti-inflammatory drug like brufen. Do
Okay.
you have any allergies?
No.
Michael, do you have any other concern you want to
Not at
discuss?
this time. Okay. Thank you very much, ma'am.
Um,
Thank you. Okay, ma'am. It was good try.
okay, wish you, Michael.
Thank you. It was a good try.
Wish just closing, doctor. Just the
Okay.
closing. I will just.
Yeah. Sure. Sure.
Michael, I wish you a speedy recovery, and this is my contact number. If
Thank
in
you.
case of any query, you can contact me. And thank you for your time.
Thank you very much, doctor. Okay, ma'am. It was fine presentation. You started the card with open-end question, empathize the patient, followed by the closed-end question. However, it was card
Mm-hmm.
focus, not the patient focus, because in your card, although like it has been written that you have to exclude diabetes, mellitus, and all these things, but you can see that the
Mm-hmm.
patient was least concerned about the diabetes and mellitus, right?
Mm-hmm.
Yeah,
Mm-hmm.
the patient was concerned about about the meeting that he's having tomorrow. To address that concern,
Mm-hmm.
first, question mark. First of all, let me show you. Although you ask about the patient knowledge about abscess ulcer and explain it, that it will take time to heal. But then you can
Mm-hmm.
say, although you are concerned about your meeting tomorrow, so let me show you
Mm-hmm.
that I can give you some remedy so that it can be helpful for you to participate in the meeting. You can speak at
Mm-hmm.
length and even you can eat the things. I will give you some painkiller. Don't worry. No, but in order to better
Mm-hmm.
understand your condition, I would like to ask some questions related to your disease. Can I? Then you can come back to the point. Then you can ask about the diabetes mellitus because you
Mm-hmm.
can
So you
see.
mean that I need to address the concern at the moment
Yes,
when the
yes, yes,
patient
yes.
asks.
Because
I just address
patient
later
focus.
on. Like
Yes, it
go.
has to be patient focused consultation, not
Mm-hmm.
the doctor focus, neither the
Mm-hmm.
doctor card
Mm-hmm.
focus. because in this card you doing the
Okay.
like card focus, not the patient focus. Because I mentioned earlier that I'm really concerned about my meeting tomorrow. It's a pressure job I've started and I have presentation. So you have to address that concern of the patient first. Okay. You let the card like in the at the place of treatment. You explore the patient knowledge. And secondly, do not use any cohesive device. Specifically, you can see there is a list in the management of symptom over here. You can see. So you can use the first and foremost. You can rinse. Secondly, thirdly, and so on. And you can see that I mentioned earlier
Okay.
that I used antiseptic gel previously, but it was not helpful. You did ask me again, so it will affect your active listening because I already mentioned this thing. So you can tell the patient, yeah, you mentioned that antiseptic
Okay.
gel never help you, so I can recommend you something else. So modify the task as per the response of the patient, right? You should design your
Okay, sir.
consultation as per the response.
Please have a seat. My
Thank
name is
you.
Dr. Suna, and I am treating doctor at Suburban Clinic today. How can I help you?
Well, actually, doctor, I need to ask you. I got, fainted. So while working in the office, and it's, there was a fainting episode had happened. So I was giving the
Okay.
presentation.
Any
So my colleagues told me that you were not able to speak clearly for a few minutes, and it's something point of concern for me. So yeah, that's what happened.
well, Mr. Alex, I'm very sorry to hear about the condition you are telling me. Could you explain me a little more about your condition in your own words?
Yeah, I told you everything that I got fainted while working, and I got um, weakness in the right side of my body. So this was the first time this had happened. There was a slurriness in my speech as well, as per the my colleagues.
Okay, Mr. Alex, would you mind if I ask few more questions regarding related
Yeah,
your concern?
yeah,
Okay, was it sudden or the gradual onset?
yeah,
You feel like unilateral weakness in the one side of the arm,
yeah,
isn't it?
yeah.
Is it related, belongs to the dysphagia, or you feel difficulty in swallowing, anything like that?
No,
There is no as such. Okay, can I examine you?
yeah.
Okay. Well, after examination, I just palpate your, auscultate your carotid, and I check your pulse rate and blood pressure. So the thing is, the condition, it looks like the things that belong to some heart conditions and some blood vessels conditions. So
Mhm.
most probably we need to exclude some condition, we call it transient ischemic attack. Have you ever heard about that?
Doctor, no. What is that?
Hello, Mr. Alex, are you with me?
Yeah, I'm with you, doctor. What is that? Actually, can you tell me?
Oh, okay. We often call it mini stroke. That could be like
A
the
stroke,
heart that
doctor. Oh my
is.
gosh, what you're saying? That stroke isn't it a serious condition?
It is not confirmed. Well, we are just suspecting this could be possibility as per your symptoms. So we will exclude this condition by doing some other test. Are you following me, Mr. Alex?
Yeah,
Okay. Do you have this happened before, or this is the first time? Are you having any long episodes lasted before?
this is the first time I'm having.
Okay. So further, we need some blood test, like the some CBC, we call it full blood count, and thyroid test, and blood glucose test, some cholesterol test, and the urea and electrolyte. That is all the related the body, some kidney test. That
Mm-hmm.
is we need required to exclude why this happened and what is the pathology behind going on. Are you following me, Mr.
Yeah,
Mark?
yeah,
Hello,
yeah. I'm
Mr.
telling you.
Alex.
Yeah,
Are you with me?
yeah,
Yeah. So, is it so far clear to you, Mr.
yeah. Clear
Alex?
now.
So, anything else you would like to ask?
Yeah, actually, I need to ask you: is there any possibility that I can have the next episode? And if it's so, then how to prevent it?
Yes, it is possible, but we need to exclude that why it is happening. For that, still we need more tests. That is, we call it CT scan and ECG. Have you ever heard about what is the ECG
Yeah,
and the
I've
CT
heard that.
scan?
Yeah.
Yes, so these are the some heart-related tests that we will do to exclude. And for this, we just need to rule out the transient ischemic attack that often we call mini stroke. Uh, am I clear so far, Mr. Alex?
Yeah.
Mr. Alex, I would like to explain a little bit more about that. This could be a possibility of this complications, and it could be belong to the heart as well as I mentioned, that blood vessels, and besides that, some GIT problems. So after all the lab results, we will review and we will make the final conclusion and make the diagnosis. And I'm very sorry to tell you about there could be possibility of some serious complications that can be happen. Am I clear so far to you, Mr. Alex?
Yeah.
Okay. So
Thank you very much,
should I
ma'am.
proceed for further test?
Thank you very much for your time is up, please. Okay, ma'am.
Thanks for visiting. Yes, sir.
Yeah, okay, ma'am. Basically, start was fine. You can see that the patient was talkative. You have started with the open-ended question. So you should not ask another open-ended question. Rather, you have to ask you have to recap to show your active listening skills, right? Afterward, anyhow, you have used the closed-ended question. Yeah, you did not explore the patient expectation. What do you think? What could be the possible reason behind this episode? And thirdly, you should not break the news directly about a mini stroke. It is the fourth point in your task, so it has to be like you have to tell the patient at that point. You can say that at the moment we are not sure what it could be, but it could be related to your heart or blood vessels. So in order to better understand your condition, we like to have some more tests, which will make a complete picture of your blood. Then we can have the I don't know how to say for the layman for thyroid function. Anyhow, we can go for the thyroid function testing. In addition to those tests, we'll also like to have a profile of your blood glucose and cholesterol and the chemical of in your body for okay, and the creatinine clearance should be used in the layman language. Okay, and secondly, we should have to have a picture of your brain and heart. For that, with the specialist test, we can say CT scan and ECG. I hope that you have heard this test before, either, right? And lastly, Mr. Mark, at this point, we are not sure, but there is a condition we can say it has to be ruled out. That's why we are testing those tests. So, condition called as kind of mini stroke. So, have you ever heard this term before? And secondly, when you are closing the card, you use the GIT. This is a medical term. Try to avoid them. Okay. Then like to what else term? No, I never heard this. No, I never heard this term before. Mm-hmm. Mm-hmm. Yeah, doctor, as you mentioned that it's a kind of problem. So in this case, should I wash my eye with salty water? Okay. And how about the allergy test? If I can go for that? This is the recently. This is the recent one I had. It's not a recurrent one. Okay, doctor. And I'm also concerned that there's a lot of discharge from my eyes. I'm concerned about the
Okay.
my VN as well.
Okay. As I told you, this is a benign condition. It will not affect your VN. And I will tell you some steps to follow as the condition is contagious. So you have to follow the steps to avoid the spread.
Okay.
So Michael, you have to avoid the close contact, and you have to wash your eyes thoroughly every 20 to 30 minutes. Michael, are you with me?
Yeah.
Okay, and I'm giving you some antihistamines or anti-allergics that will decrease your discharge and it will relieve your discomfort.
Okay.
And one more thing I wanna tell you, you have to avoid sharing the face wash and bed linens. As
Mhm.
I told you before, the condition is contagious.
Okay.
Michael, have you understood the problem so far?
Yeah.
Okay. May I summarize? Do you wanna ask something else?
No, it's fine now.
Okay. May I summarize the things for you?
Yeah.
Okay, Michael, as I told you, you presented to us with the history of itchy eyes and discharge from last 1 week, and you are suffering from a condition
Thank you very
called
much, ma'am.
viral
Your time is up.
conjunctivitis.
Thank you. Okay, ma'am. You started the card with normal greeting. However, after the greeting, you have to pick the patient queue, like something that can be seen in the card or the patient in front of you. Like I can see
Okay.
that you have red eye or pink eye. Is everything all right? Something like that.
Okay. Okay.
When I tell
ठीक
you
है.
about a
ठीक.
problem and having discharge from the last blah blah year, there was no empathetic statement.
हम्म.
Though you ask about the closed-ended question, while asking the closed-ended question
हम्म.
or inquiring the patient, although you started with the grammatical range, first question you started with the how, second with is, and it was eclipse question like this or this. You can say eclipse question. However, is repeated
हम्म.
twice, thrice. Sorry, you have asked three questions from is. Try to have the grammatical range. There is no need for the examination because the things can be seen from the naked eye. So no need to examination, and it's a
Okay.
contagious disease. So obviously we cannot go for the examination. You also explore the patient knowledge. You use some medical words such as benign and you can say contagious. So try not to use it.
हम्म.
Surprise question, though you
Okay.
confused initially, but you had tackle about the salty water question. Even you had handled the allergic reaction question. It's fine, but you did not use any lister or cohesive devices for the list of
हम्म.
details regarding the prevention of the disease for washer, bed, linen, and so on. Right?
Suburban clinic. Uh, would you like to tell your name?
Well, my name is Mike.
Okay, Mike. I am deeply sad to announce you that you are suffering from Hashimoto thyroiditis. It is an autoimmune disease which destroys your thyroid gland.
Yeah, I was informed by
So I want,
my endocrinologist doctor. I'm here because like at my endocrinologist want me to disclose this thing to my children. I'm concerned about the privacy, and I don't want to disclose it.
okay, Doctor Mike, I know your concern. I reassure you that medical records are all highly confidential. We support that every person has his own privacy. We don't disclose their personal information. And
Right.
this condition is not life threatening. Uh, do you have any other concern?
And just I mentioned that I have concern about the privacy, and I think that let them live their life.
Yes, sir. I
Yeah.
reassure you that yes, I reassure you that there is no disclosure in our setup. We maintain high privacy of patients, and their record is 100% confidential.
Mhm. Okay.
I want to inform you that please change your lifestyle
Mm-hmm.
and prevent and take all necessary preventions.
Well, actually, doctor, I just mentioned that
Do
I
yes,
mentioned that I don't want to disclose this thing to my children. I believe that ignorance is blessing, so let them live their life.
yes. I reassure you that your medical record is confidential and your close relatives uh, are not informed about it, but they must know your condition so that you get proper treatment. They must be well aware of your condition so that they can take care of your well,
Okay,
so they can get your treatment properly.
okay,
If you want treatment in future, if you want treatment in future, so your concerned relatives who are your children must be must be informed about your condition so that you get proper treatment. This is 100% confidential, and your relatives should know about your condition.
but don't you think that, doctor, it will impact their insurance policy at the same time?
Oh, yes, you cannot take your insurance policy now, but it may benefit you gain from future purpose.
Mm-hmm.
I am referring you to genetic counselor. If your children think that they also
Okay,
get this genetic disease,
okay,
so that you and your family get some genetic counseling.
okay.
Are you with me, Mike?
Yeah, I do understand what you're saying.
Are you getting my point?
Yeah,
Okay. Can I summarize this for you?
okay,
Yes. Patient data is highly confidential and we don't disclose this. But in your condition, we have to disclose because you need some treatment and proper management. So your children must know your condition so that they can get you treat well. You don't get any insurance policy now, but in future you can get that. I am referring you to genetic counselor so that your whole family can get proper knowledge about this disease. Thank you
okay. Thank you.
staying
Okay,
with me,
sir.
Mike.
You had done this card for first time. Okay, I appreciate
Yes.
your effort.
Long process.
But Masani sir, keep it up. With the passage of time, inshallah, you'll improve.
Yes, sir.
So,
Inshallah.
but the point is, there is a problem with understanding of the card. The patient is here for the discussion of that he should disclose this thing to his children or not, because you are the GP and he was diagnosed by the endocrinologist
Yes.
of the Hashimoto thyroiditis. So we should not start the way you have started. We can start the card. Hello, Mr. Mark. I can see from your file that you recently have been diagnosed with a condition called Hashimoto thyroiditis. So I hope that you have been educated by
Yes, sir.
your endocrinologist. But can you tell me in your own word that what is your concern?
Yes, sir.
I would like to help you in
Yes.
your understanding of the disease, or if you are having any concern, please feel free to ask me. Then the patient will tell you about
Yes,
the
sir.
you can say the privacy. So you have to assure the patient, Mr. Mark, first of all, as per the clinical standard practice, this is something that is one of the most important thing for us, is to keep the patient record private, right? However,
Yes, sir.
you can see that this is not a serious condition, neither it's life
Yes.
threatening, and it's run in family. Therefore, therefore it is important for you to disclose the disease like as after taking your time, whenever you make up your time, you have to disclose this disease, right? Because it's run in
Yes.
family. Then the patient asks you that, like ignorance is blessing. Then you have to encourage the patient. Mr. Mark, I appreciate your knowledge and concern. However, it is important for you to disclose this thing to your children. And the first and foremost important thing is that they would be able to manage their lifestyle. And what would happen actually? It will
Yes.
delay the onset of the disease, right? So that's why we would like you to discuss this thing with your patient, with your children, so that they can manage their lifestyle accordingly. Okay, and the prognosis of the disease and the management of the disease could be quite improved in their case. Okay, then according to the insurance policy, you can simply tell the patient, "I'm a GP.
Yes.
I don't have much understanding about the insurance, but I know that there are a lot of benefits associated with the
Okay.
yeah, there is a lot of benefit associated with this one, right?
Okay.
So, yeah. So, is it clear to you?